Hi, everybody, and welcome to Conversations with Dr. Jay Harness. You know, I got to tell you, there are times when I just get really excited about who I'm going to be interviewing, and today is one of those days. Dr. Leslie Waltke is a nationally and internationally renowned physical therapist with a clinical mastery in cancer rehabilitation. She earned her PhD in physical therapy from the University of Wisconsin. She is the Cancer Rehabilitation Coordinator for Aurora Health Care in Milwaukee, Wisconsin, which is the largest cancer rehabilitation program in the United States. She is an author, lecturer, and outstanding advocate for cancer rehabilitation. One of my favorites of her contribution was the founding of The Recovery Room, which is an educational video channel for cancer patients and survivors. Welcome, Leslie. It's great to have you here.
Dr. Jay Harness, it is always a pleasure to hang out with you. Conversations just roll. I love it.
Well, Leslie, it is such a treat to have you here today. You recently had a national podcast that I thought was one of the best I've ever seen on the difference and importance of rehabilitation and exercise oncology. And what I wanted to do in this brief conversation with you is for you to highlight the slides that you showed that day. It was truly a spectacular.
Well, thank you.
Spectacular
I'd love to. Let's roll.
All righty. Well, we have your slides up and have your screen shared. So Leslie, please go ahead for me, will you?
All right. Well, I think it's really important to start, as you well know, that people deserve the right to eventually, during cancer treatment and after cancer treatment, to maintain or maximize their return to full health, comfort, activity level, vitality. And how do we get people there? Well, it's typically done with a combination of rehab, activity, and exercise. Yet these are three really distinct things that it's really important to talk about the differences and when to use them and how to use them and how often to use them. Typically, a lot of patients don't know the difference, and a lot of medical people don't know the difference. So I appreciate the opportunity to be here with you today. So rehab, we're talking physical therapy, occupational therapy, and speech and language pathology, is really an impairment-based medical treatment. So rehab therapists will do a medical assessment, they'll do a differential diagnosis, and then they will treat impairments, which can be neurological, they can be musculoskeletal, cardiopulmonary, and we'll use outcome measures and then just provide clinically reasoned care. So examples of this would be somebody has a stroke, they go to physical therapy. Somebody has a rotator cuff repair, they go to physical therapy. Or if somebody has cancer and is going through chemotherapy or radiation or has had massive surgery, they will go to physical therapy. Now, so that's what rehab is. All right. So exercise and activity are also two separate things. So exercise is a tool that physical therapists will use very often in their clinical treatment plan. But we see people maybe once, 1 hour a week, and we know that people need to be exercising and active. So let's talk about those two things as well. So before we talk about activity, we have to talk about intensity, because people assume that if they're doing something that's light, that's activity, and if they're doing something really, really hard, that's exercise. And that is not the case. So exercise can have light, moderate, and vigorous exercise, and activity can be light, moderate, and vigorous. So intensity of what you're doing does not determine whether it's activity or exercise. All right, so that'll make more sense in just a second. So let's talk about activity first. So activity is really the bodily movements that get done to get us through our day or through our work or to the grocery store, downstairs to get the laundry done, or get in the shower. So there can be, again, light, moderate, or vigorous activity. So light activities would be like brushing your teeth, walking out to get the mail. Moderate activity may be something like pushing a lawnmower or walking the dog at a brisk pace. Vigorous activity could be something like snow shoveling if you live where I live, or heavy yard work, or chopping wood or digging holes. So that's activity, something that's done to get a life activity done. Now, from an exercise standpoint, exercise, I guess is the best way to say it is it's intentional. It is planned, it's structured and purposeful. So I'm going to do something to either improve my balance, I'm going to do something that's going to improve my strength, my flexibility, or my heart and lung capacity. That's exercise. Now, exercise too can be light, moderate, or vigorous. So let's take some examples of those. So light exercise can be slow stretching or mobility exercises, laying on a bed, or gentle yoga. Moderate exercise might be taking a brisk walk or doing some light lap swimming. And then vigorous exercise is something that really gets you out of breath, or really pushes your heart rate up into a higher zone. So those would be things like high intensity interval training, faster lap swimming, running or jogging. So light exercise typically doesn't really make you breathe harder. Moderate exercise is going to be something that you can still have a conversation, but you have to kind of take an extra breath every once in a while. And vigorous is you are pushing 9 at the line, you're really going at it. So that's the difference between activity and exercise. So just on a reminder slide, again, activity is movement that just happens through daily life. Again, it can be easy, medium, or hard. And exercise is something that can be planned, structured, and done to improve some level of fitness or some health structure in your body. So exercise improves fitness and rehab treats impairments. So this is kind of a nice one-page slide to kind of look at the difference. So what I want to point out to people who have cancer or are going through treatment right now is your body will tell you what's light, moderate, and vigorous. All right. So people say, oh, I can't do vigorous exercise because I can't do that. It's like, well, if vigorous for you is going up and down the stairs 5 times, that's vigorous. If vigorous is literally just standing up from a chair, that's vigorous. So remember, if you're either in treatment or you're recovering, your intensity may change over time. Like if you have chemotherapy this week, vigorous might be just getting to and from the mailbox. Okay. The next week, that would be a light activity because it'd be easy because you feel better. So this can change over time. It can change if you've been exercising, your capacity is going to go up. If you haven't exercised in a couple months, it's going to go down. And that is totally okay. The point is to begin moving if you have stopped, or keep moving, but it's going to change with time, what you can and can't do. One of my favorite sayings is slow is better than no, and something is always better than nothing. Because you know very well, I know very well, and most clinicians know well that people tend to stop moving during cancer treatment. It's the worst thing that they could possibly do, because they just don't know what to do or just they don't feel well enough. But once people have rehab or they start exercising, they typically feel better. And once you stop moving, you're going to start losing your capacity for activity. You can't get the lawn mowed and the dishes washed on the same day because you just don't have the physical capacity. So those are the things we don't want to lose. So from our audience, cancer rehab, probably most people should at least have an examination by a rehab therapist just to see what they may or may not need. So that's a probably or maybe. But physical activity, absolutely yes. Everyone in cancer treatment should stay active. Same thing with exercise. If you're in cancer treatment or after cancer treatment, you absolutely have to keep exercising. All right. It's incredibly, incredibly important. So again, why is this important? Because it rebuilds strength, keeps your heart and your lungs strong, helps reduce cancer-related fatigue, helps your bones, help your joints, helps your balance. We know all of these things, but what I think is really important to point out is that exercise consistently during and after treatment improves overall survival and length of life. It's associated with decreased risk of cancer recurrence in many types of cancers. So I think it's really important that it's not just seen as something that, oh, that guy's going to do a 5K next month, so he's got to exercise now. It should be an absolute cornerstone of every human experience. And again, the sicker you get, the older you get, the more important it is for people to move. And I will end then again with that slow is better than no, anything is better than nothing. And I always tell people, treat yourself like you're the most important person on the planet, because you are. And that has to include activity, exercise, and perhaps rehab.
Leslie, that was absolutely spectacular. Thank you very much. I know I had you rush through that because we've got a time limit on this whole thing. But you're a warrior. You've been at this 30 years.
Yep.
And I'm curious to hear from you, with particularly in light of the challenge clinical trial last year, what you see going on there at Aurora as a shift from my oncology colleagues to listening more and more to your wisdom, and what you see that we can do both nationally and globally to implement exactly what you're talking about.
Yeah. Well, I think today was a good start by really educating clinicians on the difference between rehab, exercise, and activity, because they're three clinically different things that are all critically important. Right. So there are places in the US where cancer rehab is completely standard of care. Right. That is there in some places. Is it there across the planet and across the country? Absolutely not. I think one of the biggest gaps that we have there is not that hard to fix. It's an education gap both on the rehab side and on the medical side. So most cancer physicians, medical oncologists, surgical oncologists, radiation oncologists don't know what rehab therapists do. So they can't truly understand the breadth and depth of the clinical advancements that we can give patients, create for patients. And really what's fortunate is that is very robust and healthy for the cancer program, right? Because patients are healthier, they are less expensive. So it's a huge win-win. And then rehab therapists are not given a really robust cancer rehab education when they're in school either. So they come out of school saying, I don't know what to do with somebody who has cancer. So that's probably the biggest problem in creating the standard of care. Right. And then a lot of rehab therapists that are treating this will just be focused on postoperative care, and they don't wrap enough into the exercise prescription that every single human should be on. And every single human that's been diagnosed with cancer, it multiplies the importance of an exercise prescription. And then making sure that, yeah, they can do it for 3 months. They need to do it for the rest of their life.
Yep. Yeah,
So somehow
absolutely.
maintaining that into the longitudinal care and or coordinating with exercise specialists that can help your patient continue when they don't need that rehab therapist level of
Yep.
care anymore.
Yeah, at the national level, I've been involved in trying to get the fitness industry really
Yep.
interested in this and in chronic disease management, if you
Yep.
will.
Yep. Yep.
I think that's really important. One of the problems, of course, with my colleagues is, oh, I'm not going to refer somebody to a gym. They're dirty, grubby, whatever.
Yeah.
And those guys don't know what they're doing, which is not true. You look at the
Right.
Live Strong program with Cancer Fit, you look at all the other things. So we are in evolution. Now,
Yep.
when it comes to the educational side, as you know, the majority of your physical therapy graduates, as you just said, don't know that much about cancer rehab. Do you
Mhm.
see that changing at all, Leslie?
It certainly is. There is certainly a trend towards more PT schools spending more time on it. And there are more, I have myself, I teach, many of my colleagues do a lot of robust postgraduate education in cancer rehab. So the world is, the needle is, the needle is moving. We're moving it. I mean, again, it's slower than it needs to because we have this massive volume of cancer survivors. But we're moving the needle. But again,
Okay,
it's,
well,
like you said, it's very education based.
yeah. Well, listen, I would love to have this interview run for about 30 or 40 minutes because you're so special and so knowledgeable. Any final thought, any final wisdom that you want to share with my audience?
I think whether you're a clinician or whether you're a patient, it is critical to make sure if everybody says the word exercise, people are more likely to do it. So if a nurse says it, a physician says it, if your physician says, yeah, you need to go to rehab, you will go to rehab, patients do it. Right. So it's really the culture on the oncology side that has to drive this conversation. And patients need to know that, yes, they can get through this and healthier, stronger, better with better outcomes if they're active and if they're in rehab.
Oh, fantastic. Well, again, I just cannot thank you enough for the privilege of your time today. And for those of you watching, please also join us at cancerfitness.org. We have videos there. We'll have this video posted. We have written blogs. We have all sorts of information about what exercise oncology is all about. So please just remember, until we meet the next time, just keep moving.